Hey, and welcome back to Pills and Bills. Let's jump right into our review of fentanyl, or Duragesic. It's one of the most potent opioid medications we use in clinical care, and it requires experience and caution to use appropriately. Fentanyl is a synthetic opioid, meaning it's fully man-made rather than derived from the original natural opium. Today we'll be specifically referencing the transdermal patch, but fentanyl also comes in IV, IM, buccal, sublingual, and intranasal forms. And next we have our PharmaLink phrase. This is just a quick memory hook that your brain can latch onto to better remember the brand and generic pair. You might not know that fentanyl is a highly lipophilic drug, which allows it to readily cross the blood-brain barrier extremely fast. That means that we rapidly penetrate the CNS and is part of why it's so powerful and fast-acting. Fentanyl patches are reserved for severe, ongoing chronic pain, such as advanced cancer pain. It provides slow, steady opioid delivery over days, not rapid relief. Other dosage forms like IV can treat more acute severe pain. Fentanyl patches should never be used in opioid-naive patients. Moving to our mechanism of action, fentanyl works by strongly activating mu opioid receptors with additional activity at kappa and delta receptors. This suppresses pain transmission by inhibiting the release of excitatory neurotransmitters like substance P and glutamate. Compared to other opioids, fentanyl has a much higher binding affinity at the mu receptor. This means it produces far stronger effects at much lower doses. We do have a high-yield review on opioids earlier in the chapter if it's helpful to compare. It's important to educate patients that the fentanyl patch should never be exposed to heat. This includes heating pads, electric blankets, hot tubs, saunas, or even high fevers. Heating the patch will increase skin absorption, causing fentanyl to enter the bloodstream too quickly, which could potentially lead to overdose or respiratory failure. Okay, moving to side effects and why they happen. Constipation happens because fentanyl activates mu opioid receptors in the GI tract. This slows intestinal movement, reduces peristalsis, and increases water absorption from stool. Unlike other side effects, this one does not improve with tolerance, which is why bowel regimens are often needed. Nausea may occur because fentanyl stimulates the chemoreceptor trigger zone in the brain. This is an area that senses nausea-triggering chemicals and activates the vomiting reflex. This tends to be a class effect of all opioids. Due to its potency, fentanyl has many black box warnings. The first is CNS and respiratory depression. Fentanyl can severely suppress the brainstem's respiratory drive, which is the primary cause of fatal overdose. Fentanyl patches specifically have a potential for accidental exposure. It should be stored properly, particularly away from children or pets. Like all opioid medications, fentanyl strongly activates the brain's reward pathways, creating a high risk for dependence, misuse, and addiction. If starting a fentanyl patch, it must be started and adjusted very slowly, with careful monitoring to avoid rapid accumulation and potential toxicity. And that completes our review. See you next time.